Good afternoon. As I said, I'm Karen Lipson. I'm with LeadingAge New York, which is an association of not-for-profit and public providers of long-term and post-acute care services and aging services. Thank you for the opportunity to testify today. We've provided you with detailed written testimony, and I'm just going to provide a few highlights. The message I want to leave you with today is that we need a new approach to long-term care policy in New York State. For too long, our principal focus in long-term care policy here has been how to reduce Medicaid spending in long-term care. We need to do better than that. We need a renewed focus on revitalizing long-term care. We need a renewed focus that includes investment, Medicaid dollars in long-term care services to cover the increased costs associated with COVID, to cover a reasonable trend factor, and to enable providers to pay the healthcare personnel that work in long-term care a competitive compensation, which they so clearly deserve. We also need a focus in our new 1115 waiver on the needs of older adults and people with disabilities who need long-term care services. Medicaid rates were inadequate before the pandemic, and they are even more inadequate now. For 14 years, long-term care providers have gone without a Medicaid trend factor. For the past 4 years, long-term care providers have had to endure deeper Medicaid cuts than any other healthcare sector. And there's a graph at the back of our testimony that shows the comparison between the cuts imposed on long-term care in comparison with the other healthcare sectors. Long-term care for the past 4 years has endured deeper cuts. And remember, long-term care providers rely heavily on Medicaid. There is not much private pay or commercial insurance in long-term care services. So as a result, when there are Medicaid cuts or increased costs, long-term care providers cannot turn to their commercial insurers for increased reimbursement. They can't raise their prices. They just have to absorb the Medicaid cuts. So going into the pandemic, our long-term care providers were in a weakened condition. They were already struggling with staffing shortages. Today, the situation is markedly worse. Costs have risen dramatically, but instead of investing more in long-term care, as most other states did, New York State reduced Medicaid rates at the beginning of the pandemic by 1.5%. Older adults and people with disabilities and the providers that serve them have suffered mightily during this pandemic. We have lost beloved members of our community. The people we serve have struggled with isolation. They have struggled with the loss of programs that have been forced to close for prolonged periods of time, like adult day health care. And the providers that serve them are struggling with ever-changing restrictions and requirements, ballooning administrative demands, and exorbitant costs for testing, PPE, and disinfectants. Just to give you an order of magnitude of the increase in cost, we estimate that nursing homes alone have spent $350 million on PCR tests in 7 months. On top of all of this, we are experiencing the worst staffing shortages in memory. The situation is really dire, and our members are doing everything within their power to address the staffing shortages. They're doing everything they can within the available resources which are inadequate. They are paying signing bonuses, shift differentials, longevity bonuses, and raising wages. They're also being forced to rely on staffing agencies. Many of our members have never used staffing agencies before. The staffing agencies are charging exorbitant rates, and also some do not even have sufficient staff to address the needs of our members. So we need to pay long-term care providers enough to allow them to cover their costs and to allow them to compete effectively in a very tough labor market for highly qualified workers who perform demanding jobs. It would be a mistake to assume that the federal government will step in and solve this problem. To date, the provider relief funds that the federal government has provided have been very beneficial and welcome, but they have covered only a fraction of the financial impact of the pandemic. We estimate that for nursing homes, the provider relief funds have covered less than half of the financial impact. The enhanced FMAP funds, which you may have heard about for home and community-based services, are also a welcome infusion, but they are short-term, they're not a long-term solution, and they address only home and community-based services. Our early read of the Build Back Better Act seems to indicate that there will be a sizable investment in home and community-based services. Again, a very welcome investment, but there does not seem to be a similar investment in nursing homes. It would do a grave disservice to the 90,000 plus residents and their families who rely on nursing homes for 24/7 skilled care if we decided to continue to deny nursing homes the resources they need to deliver high-quality care. Everyone should have access to high-quality care, especially those who are most vulnerable. I'd like to say just a few words about managed long-term care. Our members include not just providers of long-term care, but managed long-term care plans that are sponsored by not-for-profit providers. These members believe that because of their expertise in caring for older adults and people with disabilities, they are able to do a better job of coordinating care of individuals that they serve. And if you recall, in many areas of the state, in most areas outside of New York City, it was very difficult to access home care before the advent of managed long-term care. There's been a lot of discussion today about spending growth in managed long-term care. And I think if you take a look at the managed long-term care rates and enrollment growth, you'll see that the spending growth is due to enrollment growth. The administrative component of the rates have been capped for as long as I can remember. The care management components have either gone down or remained flat. The rates overall are effectively flat. So enrollment has grown dramatically. And remember, managed long-term care plans do not assess eligibility for enrollment in managed long-term care. Those assessments are done by the state's independent entity, Maximus, through the CFIC, which off the top of my head, I can't remember what the acronym stands for. But the plans don't determine eligibility, the CFIC does. I also want to point out that 85% of members of managed long-term care plans, based on the state's annual consumer reports, indicate that they rate their plans as good or excellent. So yes, there are problems with managed long-term care. The stories we heard today were very disturbing. Those things shouldn't be happening, but there are also people who are satisfied with their plans. We've argued for strengthening the role of provider-sponsored plans in managed long-term care and PACE programs. These smaller plans and programs are closer to their members, they're closer to the providers that serve them, and we believe that their position in the program should be strengthened. We're looking forward to working with you to invest in revitalizing our long-term care system. We're hoping that long-term care will be a top priority in the upcoming state budget. And I'll take any questions.
What would strengthening the role of provider-sponsored plans translate into? How would we do that?
So there are some new initiatives that the state is undertaking to encourage enrollment in integrated Medicaid and Medicare managed long-term care plans. And the way those initiatives are rolling out, provider-sponsored managed long-term care plans are disadvantaged. We believe in integrated Medicare and Medicaid managed care, But what is happening is that people are being default enrolled from their mainstream managed care plans into MLTC, no, I'm sorry, not MLTC plans, DSNP plans when they turn 65. And because managed long-term care plans, provider-sponsored managed long-term care plans, don't operate mainstream plans because they're sponsored by long-term care providers, there is no default enrollment into long-term care provider-sponsored managed long-term care plans. So finding a way to encourage enrollment in those long-term care provider-sponsored plans would be a way to strengthen the role of those plans in that program. We're concerned about PACE programs because as enrollment is funneled through the CFIC, we've heard that Medicaid beneficiaries are not receiving information about PACE programs, that there's sort of a tendency to channel people into the conventional, partially capitated, managed long-term care plans and not provide full information about PACE programs. So that's another concern.
Okay, maybe in follow-up to this hearing, you could talk with us more about those couple of items.
Sure.
Okay. Ed, question? No? Okay, thank you very much.
Thank you.